Hello, everybody. Hi, happy Monday. I hope that everybody enjoyed their weekend and enjoyed the game. It was more of a sleepover than it was a game, I guess, unless you were a fan of one of the teams that was playing. But I did have a chance to enjoy the Puppy Bowl, which I found to be more interesting than actually the that sleepy game. If you're into it. But anyway, listen, I want to thank everybody for joining. I did get a good response from a number of people that are very, very interested in this. I always like to look at new research and research that's directly related to so many conditions, but especially, of course, fibromyalgia. And I did get the information on this research program that was actually published in 2018. Well, since it's 2019, that's great because this is new stuff, so to speak, that came out. And it's interesting. The research paper is called the Fibromyalgia Syndrome. They're still working on the syndrome aspect. Case report on controlled remission of symptoms by dietary strategy. And they start out with the usual and customary research definitions of fibromyalgia. It's a challenging, complex, chronic, disabling, heterogeneous, poorly understood condition. Got all those things involved in there. Musculoskeletal, widespread pain, fatigue, mood disturbances, cognitive impairments, that would be what we would call fibrom fog, and let's see, symptoms that varied from mild to severe. And they didn't really mention anything as far as more women than men. It actually said heterogeneous, which I thought was great, rather than the usual and customary females versus males. But anyway, the research paper has to do with a 34-year young female that was having some health problems anyway. But when she went in for surgery, all of a sudden, all heck broke out. And she started having these symptoms all over her body, the musculoskeletal, fatigue, IBS, irritable bowel, all the different things that you've heard of that fibromyalgia, especially if you've had them, fibromyalgia patients have. It got to the point where it was so bad she couldn't even get out of bed. She went to a number of doctors who treated her with NSAIDs and all sorts of different medications. And she mentions in the paper that many of them actually caused worse problems than what she actually had before she had taken them. Keep in mind, again, I've mentioned over and over, pharmaceuticals have side effects, and many of them for many of the patients are similar to the same symptoms that you have. So look them up and make sure you know what the side effects are. If you're already having musculoskeletal pain and one of the side effects from your medication is musculoskeletal pain, don't take it. By the way, this is a new location. I've not been here before. I've done them from Colorado. I've done them from outside in Flagstaff in a snowstorm. This is from my clinic, one of my treatment rooms. In the background, if you see it or not, I have a wonderful, very relaxing lakefront, which makes it very nice and relaxing for the patients, obviously. But anyway, because of different scheduling and so forth, I thought we'd have the program from here. So this 34 young lady, so to speak, really started having some horrific problems from fibromyalgia. Remember, based upon our findings, you already have it, you're born with it, and it's usually triggered to a much greater deal by some physical, emotional, or chemical trauma. And in her case, it was surgery. It was sort of like the tipping point that caused her to really have a lot of additional problems. So what she did, in effect, with her doctor was what we have suggested, and that is to look at the dietary aspect of her life to find out whether or not some of these things might be adversely affecting her. And so what she did was she actually went on a diet. And the diet was to cut out as much sugar as possible. And so she went on a what we call a low glycemic carbohydrate diet. You know, low glycemic in itself means that you have you're taking in sugars, but from things that process through your system in a regular basis, not the sucrose and the artificial sugars that cause high peaks and then valleys and so forth with sugar. And so she went on, like I say, a restricted hypoglycemic diet. And as I'm reading this, I'm looking at it and saying, man, this is what we suggest to patients. This is exactly our pre-protocol that gets rid of a lot of things. Well, believe it or not, results were quite rapid. Improvement in symptoms were sometimes a few days. And within about 2 to 3 months, almost all of her symptoms were gone. And because of this type of dietary restriction that she placed herself under. So when I introduced this in Facebook and I said, new research and so forth, it was tongue in cheek, so to speak, because this is the same thing that we've been using for our patients. And so this is just like a slap on the back and saying, yes, you're doing the same thing that even this research shows that is so very, very successful. So again, the medications that you were taking, she stopped. She said these are no good. As a matter of fact, they even suggested that she take additional medications for herself while she's doing this. And he said, no, I don't want to interfere with anything. I don't want to have to take anything that might throw a wrench into what I'm already taking, especially since I'm starting to feel better. So her symptoms started to reverse quite dramatically. Now look, we give this program to fibromyalgia patients and any patients that come in that have high levels of inflammation. If you're having an inflammatory response, why put gasoline on the fire? And so what she did was she took out a lot of the things that were inflammatory from her diet. When our pre-protocol, what we place patients on is we take them off of sugar, gluten, trans fatty acids, and dairy while they're going on this detox program. She didn't even do a detox. That's all she did was she just went on this to take these bad things out of her diet, which was fascinating. But what she did was she excluded, like I say, a lot of the sugars. Keep in mind, if you're going to eat vegetables, you can eat fruit. Almost all of them have one form or another sugar. But again, it's that sugar that processes through your system in a proper fashion. And so what she actually did was she actually tested it. She tested her system by adding certain foods that she knew were high level sugar just to see what would happen. And lo and behold, it increased the symptoms over again. So she knew that was a problem, so she stayed off of that. But she went on this restricted, like I say, hypoglycemic diet to a certain degree where she cut out as much sugar or sugar content as she could and any foods that actually related to it. And so within about 2 to 3 months, like I say, her symptoms were almost all gone except for some that lingered, she said. And they were either from secondary conditions, as I mentioned, everybody in fibromyalgia has secondary conditions, or from the fibromyalgia itself. Keep in mind, our pre-protocol takes care of the things that you're ingesting that we can control. The fibromyalgia aspect of the treatment with the guaifenesin actually reverses the fibromyalgia to a much greater degree, where I actually take care of all those other symptoms that she has. But she didn't do that. She just was on just the dietary aspect, which meant a big difference for her anyway. As far as her health is concerned. And we see this also when we have patients come in and we place them on this restricted hypoglycemic diet. They have pretty dramatic changes very, very quickly. As a matter of fact, I just had a patient start in effect last week, and already he's starting to have some symptom relief just because we placed them on this restricted dietary thing. I hate to use the word diet. It sounds like you're dying, for crying out loud, but you're not. Okay, you're just taking things out of your body and out of your system that are blocking your body's ability to get better, and that makes a big difference. So some of the symptoms, like I say, many of them in her case did disappear. Some of them were secondary conditions that were made better but did not disappear. And some of them were directly related to fibromyalgia, which until she goes through the secondary aspect of the fibromyalgia treatment itself, the guaifenesin protocol, she probably will still not have. So she tested it. She found out what foods actually were adversely affecting her health. We do the same thing. We take all of these things I mentioned, sugar, gluten, trans fatty acids, and dairy out of your diet for about 2.5 weeks, 2.5, 3 weeks while you're on a very gentle detox program. It's a liver and kidney detox. Why? Because most of the patients have been through so much as far as their medication and so forth. The liver isn't functioning correctly. If the liver doesn't function correctly, you can't process the foods properly through your system. And that's also adversely affects the kidneys. So when we finish the pre-protocol, the nice thing about it is the patient is pretty well clear, and he can or she can process foods through their system in a normal fashion. And the nutrients are much higher, and the toxic wastes are evacuated much more cleanly and clearly and rapidly through their system, rather than hanging on and causing secondary problems. You know, this is number 53, the 53rd project, the talk that I've given. I'm very, very proud of many of these things that we've done and introduced to so many of you. So if you have fibromyalgia, this is great. If you don't have fibromyalgia, but you have a lot of aches and pains and some things that just aren't being taken care of properly by whatever medication and so forth, try the restricted hypoglycemic diet. It's not going to kill you. There's a lot of foods. We're just taking the things out of your diet, okay, out of your foods that you eat, that are causing you to have a lot of additional pain. And so if we can reduce that, that can make a world of difference. And oftentimes, like I say, it can be done very, very quickly. It doesn't have to, you don't have to wait a month for this improvement to occur. And the vast majority of the time, patients lose weight. As I mentioned to you, I went on my own restricted hypoglycemic diet, and I went from 212 to about 180 pounds. And so everybody says I've started looking sick, so I've actually gained about 5 pounds back. But it's your body actually telling you, hey, you're actually having additional weight on you, and you should really evacuate this so that your body can be a lot healthier. If you don't know what 5 pounds is, go to the supermarket and pick up 5 pounds of sugar. You'll know what that is. How'd you like to have about 2 or 3 of those hanging around your waist? That's an awful lot of pressure exerted on areas of your spine and so forth that is not good for you. So this 34-year young lady, literally within a couple of months, just by doing some dietary changes and restrictions, has made a whole world of difference on her health. She's out of the bed. She's able to function, and about 85% of her symptoms are gone that were adversely affecting her, not able to live a normal life. At 35 years of age, that's very, very young. She's got so much living to do beyond this. I'd love to introduce her to the rest of the protocol so that we can get her back to even feeling a lot better in her overall life itself, and enjoying life to its fullest. And that's what we try to do. We try to bring information into you that we know clinically has worked for us, not just research, but the nice thing about this research policy that I've been covering is that it mimics the same thing we've been doing for years in our clinic to help patients. Isn't that interesting that it's taken maybe decades for them to do the same thing that we learned about so many years earlier that we've been actually placing our patients on. So, it's about 15 minutes, and I hope I got the point across. Restrictions of sugar, gluten, trans fatty acids, and dairy are very, very important. Most of them are inflammatory, and so they're not good for you. Hello, Gail. How are you? Happy day. Whoops. From sunny, cold Alberta, Canada. Well, it's been cold and damp, but not exactly like Canada, that's for sure. I do hope and pray that you're having an enjoyable time, and you're listening and following. Gail's been with us for quite a while now, as far as the instructions are concerned, and following my talks. And I appreciate that. And any of you also, if you have any questions and so forth, please feel free to, while I'm here or otherwise, check in and send information. And I promise I'll answer them as quickly as I can. Thank you so very, very much. Really appreciate everybody listening. Again, you can check back. This is number 53. You can check on the other 52, or if you missed part of this one, just go back and you can actually check on them. We save each and every one of them. I want to thank you so very, very much. And I don't know where I'll be speaking from next week, but I should be here on Monday, 12:30, with another wonderful, exciting subject that we'll be covering, and I'll introduce that to you as the week goes by. Take care and be safe, everybody, and enjoy. Bye bye now.